There's a number sitting in your blood work right now, today, that can tell you where your health is heading 3, 5, even 10 years before you'd ever notice a single symptom. Most people have seen this number on a lab report at some point in their life. Most people have completely ignored it. And by the time a doctor finally sits you down and says the word diabetes, this number had already been quietly climbing for years, waving a flag that nobody taught you how to read. Today, we're reading that flag together, and by the end of this video, you'll understand your own blood work better than most people ever will. The number we're talking about is called A1C, sometimes written as HbA1c. If you've had blood work done in the last few years, there's a good chance it was on your lab report, tucked somewhere between your cholesterol numbers and your kidney function markers, usually with zero explanation attached to it. Most people's eyes skip right past it because nobody ever told them why it matters. So let's fix that right now, in plain language, without the confusing medical jargon that makes most people tune out the second a doctor starts talking. Here's the simplest way to understand what A1C actually measures. Every time sugar enters your bloodstream, some of it attaches itself to your red blood cells, specifically to a protein called hemoglobin. This isn't a temporary thing that comes and goes with your last meal. Red blood cells live for about 3 months before your body replaces them. So the amount of sugar that's attached to those cells builds up over that entire lifespan. A 1C measures the percentage of your red blood cells that have sugar stuck to them. In other words, it's not a snapshot of what you ate for breakfast. It's a 3-month average of how much sugar has been floating around in your blood day after day, whether you were paying attention or not. This is exactly why A1C is so different from a regular blood sugar check. If you check your blood sugar with a finger prick, you're seeing a single moment in time. Did you just eat? Are you stressed? Did you sleep badly last night? That number moves around constantly, but A1C doesn't care about any single moment. It's the report card for the last 3 months of your entire life, averaged into one number, and that's exactly why it can catch problems that a single blood sugar reading would completely miss. Now, here's where it gets interesting, and this is the part that almost nobody explains clearly. Doctors generally consider an A1C below 5.7% to be in the normal range. Between 5.7 and 6.4% is typically labeled prediabetes, and 6.5% or above is generally the threshold used to diagnose type 2 diabetes. Those ranges sound simple enough on paper, but here's the question I want you to actually sit with for a second. Do you know what your last A1C reading was? Not roughly, not I think it was fine. The actual number. If you can't answer that right now, you are far from alone. Most people have never had this number explained to them in a way that made it feel worth remembering. Let's talk about why this number can act as an early warning system years before diabetes actually gets diagnosed. The progression toward type 2 diabetes isn't usually a sudden event. It's a slow, gradual process that can unfold over 5, 10, sometimes 15 years before a diagnosis is made. In the earliest stages, your body's cells start responding a little less efficiently to insulin, the hormone that helps move sugar out of your bloodstream and into your cells for energy. Your pancreas compensates by producing more insulin to force the same result. For a long time, this compensation works well enough that your fasting blood sugar might look completely normal on a basic test. But your A1C, because it reflects the accumulated average over months rather than a single fasting moment, can start creeping upward long before your fasting glucose ever raises a red flag. This is the entire reason this number matters so much. It's often the earliest visible signal of a process that's already been quietly unfolding inside your body for years. Think about what that actually means for a moment. Somebody could go in for a checkup, have their fasting blood sugar tested, get a completely normal result, walk out feeling reassured, and still be sitting quietly in that prediabetes range on their A1C, a range that, left unaddressed, often continues climbing year after year until it eventually crosses into a diabetes diagnosis. The scary part isn't the number itself. It's how often this number gets ordered on a lab panel and then never actually explained to the person it belongs to. Here's a question worth pausing on. If your A1C has been slowly climbing over the last several years, would you even know? Most people have their blood work done annually, but very few people actually go back and compare this specific number year over year. They compare their weight. They compare how they feel. But this number, the one with arguably the most predictive power of all of them, usually goes completely unexamined. Let's get into what actually happens inside your body during this slow climb, because understanding the mechanism makes this so much less abstract. Insulin resistance doesn't happen overnight. It builds gradually, often influenced by a combination of genetics, activity levels, sleep quality, chronic stress, and the overall pattern of what and how often you eat. Not any single meal or any single day, but the accumulated pattern over years. As your cells become less responsive to insulin signal, your pancreas has to shout louder and louder to get the same response, producing more and more insulin just to keep your blood sugar in a normal range. For a while, this works. Your fasting glucose looks fine. You feel completely normal. There are no symptoms because your body is successfully compensating. But compensation isn't the same as being healthy. It's your body working harder behind the scenes to maintain the appearance that everything is fine on the surface. This is precisely why A1C can act as a year's early warning, because it reflects a rolling average. It starts to show the accumulated effect of that quiet insulin resistance long before your pancreas eventually loses the ability to keep compensating. And by the time compensation fails, which is usually the point where fasting glucose numbers finally rise and a doctor uses the word diabetes for the first time, the underlying process has typically been running in the background for years already. The diagnosis isn't really the beginning of the story. It's usually closer to the middle or even later. So what should you actually do with all of this information? First, the next time you get blood work done, specifically ask whether A1C was included, and if it wasn't, ask your doctor whether it's worth adding, especially if you have any family history of diabetes, carry extra weight around your midsection, or have noticed increased fatigue, more frequent thirst, or unusual changes in your weight. Second, and this is the part almost nobody does, write your A1C number down somewhere you'll actually see it again, and compare it every single year. A single reading tells you where you stand today. A pattern across several years tells you which direction your body is actually heading, and that trend is often more valuable than the number itself. Here's a question I'd genuinely love for you to answer honestly in the comments. When you get your next round of blood work done, are you going to actually look for this number? Or has this always been one of those things you just let your doctor handle without a second thought? I read every single comment on these videos, and this exact kind of question is what tells me which numbers people actually want explained next. Let's make this even more concrete with a real-world pattern that plays out constantly, because it's easy to talk about numbers in the abstract, but much harder to ignore once you see how it actually unfolds for a real person. Picture someone in their mid-40s feeling completely fine, no symptoms at all, going in for their yearly physical because their employer's insurance plan requires it. Their fasting blood sugar comes back at 98, comfortably inside the normal range, so nothing gets flagged. Nobody mentions their A1C because it technically falls at 5.8%, just barely into the prediabetes range, but low enough that it doesn't trigger an urgent conversation in a 15-minute appointment packed with other topics. The following year, same routine, fasting glucose still looks acceptable. A1C ticks up slightly to 6.0. The year after that, 6.2. Nothing about how this person feels has changed. No weight loss, no dramatic fatigue, nothing that would make them think something is wrong. Then, in year 4, fasting glucose finally crosses into a range that gets flagged. A1C comes back at 6.6, and suddenly the word diabetes enters the conversation for the first time, as if it appeared out of nowhere. But it didn't appear out of nowhere. It had been quietly writing itself into this person's blood work for at least 3 years before anyone said the word out loud. This is exactly the gap this video is trying to close for you. Not by creating fear, but by making sure you're the kind of person who catches that slow climb in year 1, not year 4. Now let's talk about the flip side of this story, because it's just as important. Insulin resistance and rising A1C don't move in only one direction. They respond to changes just as consistently as they build up in the first place. There are documented cases where people whose A1C had drifted into the prediabetes range brought it back down into a normal range within about a year through consistent changes to movement, sleep, and eating patterns without any dramatic overhaul of their entire life. This matters because it reframes what this number actually represents. It's not a life sentence once it starts climbing. It's closer to a dashboard warning light, something designed to give you enough advance notice that you still have real influence over which direction the story goes next. Now let's talk about something equally important. What you can actually do if your A1C is creeping upward, because this isn't a number you're powerless against. Unlike some health markers that feel fixed no matter what you do, A1C responds meaningfully to changes in daily patterns, and it responds faster than most people expect. Because red blood cells turn over roughly every 3 months, meaningful changes in blood sugar management can actually show up as a lower A1C at your very next test, not years down the road. Movement is one of the most well-documented factors here. Physical activity, especially the kind that engages large muscle groups consistently, helps your muscles pull sugar out of the bloodstream more efficiently, essentially giving your insulin a helping hand instead of forcing your pancreas to do all the work alone. This doesn't require anything extreme. Consistency over time tends to matter more than intensity in any single session. Sleep is another factor that rarely gets connected to blood sugar in people's minds. But poor sleep has been associated with reduced insulin sensitivity, meaning a few nights of bad sleep can genuinely nudge your blood sugar handling in the wrong direction, even if your diet hasn't changed at all. And the pattern of your eating, not necessarily eliminating entire food groups, but paying attention to how often you're eating throughout the day and how much of your intake comes from rapidly digested carbohydrates versus fiber, protein, and healthy fats, and plays a meaningful role in how hard your pancreas has to work throughout each day. Here's another question worth sitting with, because I think it reframes how a lot of people think about this topic. If you knew with complete certainty that a specific number in your body was quietly rising every single year, completely invisible to you, would you want to know about it now, while there's still time to change its direction? Or would you rather find out only once a doctor uses the word diabetes for the first time? I think most people, once they actually understand what this number represents, would rather know now. And that's exactly the point of this video. Let's bring this back to something concrete you can do literally today. If you've had blood work in the past year, go find that lab report right now, or log into your patient portal if you have access to one, and look specifically for A1C. If it's there, note the number. If it's not there, that's useful information too. It tells you this is a conversation worth having at your next appointment. And if you've had blood work done multiple years in a row, take 5 minutes to actually line those numbers up next to each other. You're not trying to self-diagnose anything. You're simply doing something almost nobody does, actually looking at the trend of a number that's designed to reveal exactly this kind of trend. There's one more piece of this worth understanding, because it explains why doctors don't always bring this number up themselves, and it's not because they don't care. In a typical appointment, doctors are working through an enormous amount of information in a very limited amount of time. Blood pressure, cholesterol, kidney function, medication reviews, whatever concern actually brought you into the office that day. A single number sitting quietly within a normal or borderline range, especially when nothing acutely urgent is happening, can understandably get deprioritized in that conversation, not out of negligence, but simply because there's only so much that can be covered in 15 or 20 minutes. That's exactly why understanding your own numbers and knowing which specific questions to ask puts real power back in your hands instead of leaving it entirely dependent on whether a busy appointment happens to have enough time to cover everything. Before we wrap up, here's one final question, and I genuinely want to know your answer. Out of everything covered in this video, was there a part that completely surprised you, whether it was learning what A1C actually measures, understanding how far in advance it can act as a warning sign, or realizing how much influence you actually have over where that number goes next? Tell me in the comments, because it helps me know exactly which health topics to break down like this next. If this video finally made sense of a number you've seen on a lab report for years without ever understanding what it meant, that's exactly what this channel exists to do. Take the tests, the numbers, and the terms that get mentioned in passing during rushed appointments and actually explain them the way they should have been explained the very first time you ever saw them. We already looked at the blood pressure number most people overlook. Now you understand the blood sugar number that can warn you years ahead of time. There's a whole list of these hidden numbers sitting in your own blood work right now. And in the next video, we're going to uncover another one that might be the most misunderstood of them all.